And the next one was what is the difference between painless vaccination and the normal vaccines, ma'am? Which is better?
Okay, so actually I wouldn't say which is better because both of them are equally efficient. So there's nothing to be considered. The only difference is that affordability of the patient. So if the parents think that they don't want the child to cry or they don't want the child to suffer, then they go for a painless. Otherwise, both are equally efficient. There's no difference in that. So
Okay,
painful
okay,
and
ma'am.
painless both are good only.
Okay, ma'am. Oh, yeah. And next one was how to differentiate between a normal cough and a cough that is associated with COVID, ma'am, for a
Okay.
child.
Okay, actually it's very difficult because COVID has symptom that is very common in any of the person. So it's very difficult to differentiate. So I may tell that we cannot differentiate. Actually, we cannot differentiate. We can consider if you are thinking COVID in a child or you want to test a child. So you may have certain criteria. That is like if the
Okay.
child is having fever, cough, cold, and then fever at least lasting for 48 hours and family history should be there because child is not going out and getting some COVID and coming inside. So family history of COVID, if the somebody elder or parents or grandparents who or any worker who is coming to the home is tested COVID positive, then you may consider that cough as a COVID cough. Otherwise,
Okay.
anything, even the normal RSV virus is going to cause a sneezing and the cough for the child. It's absolutely like we cannot differentiate that. So these are the
Okay.
symptoms: fever, cough, cold, and conjunctival congestion. We say that is redness of the eyes, conjunctiva, and then watering of the eyes. These are also considered as a COVID symptom in child. Okay, and of course these are also considered as a viral infection symptoms. So we cannot differentiate these. And any abdominal pain, diarrhea, even this as is considered to be a COVID symptom. So we can,
Okay.
if we are having one or more of these, you may go considering pandemic as a situation, you may go for a test. Especially if
Okay.
somebody else from the family is also suffering from that, then you may consider to
Okay.
go for it.
Okay. Okay, ma'am. And the next one was if the child is tested COVID positive, after how many days should the child go for a regular vaccine, which was scheduled, ma'am?
Okay. So for any child who is being tested positive, I would say that actually the protocol is that the child should be under quarantine for 14 days and after that the child can be going. But we say that if the child is having symptom for more than 14 days also, then it is better to stay in quarantine at least like till the symptom subsides, like fever or cold or cough, whatever. Because another vaccination, the take of the vaccination may reduce or whether it's the adverse effect of vaccination will not be known if something is going to have. So let this get settled and then you can go for it. So quarantine of
Okay.
at least 14 to 21 is considered and then you can go for a regular vaccination.
Okay, okay, ma'am. Okay, ma'am. Yeah, and the next one was how many liters of water should per day a child should drink, ma'am?
So again, when you are saying as a child, just give me the age also, it will be very useful. So for a less than 1 year, we don't give any
Yeah.
extra water. Okay.
Yes.
So 1 to 3 year, how much ever they are able to take. What we take
Okay.
is that the urine output of the child should not be dropping below 5. That is all
Okay.
important. So how much ever they want, they can. But be it like around 10 years, they can take around 1.5 liter to 2 liter. I can say that
Okay.
way. And then around
Okay.
15 years, they can take around 2.5 to 3 liters. So depending upon
Okay.
the activity of the child, how much they are sweating and climate, all these taking into consideration. Whatever
Yes.
it is, so all we need is like urine output of the child throughout the day, at least of 5 should be there. But if it is less than 1 month newborn, then it should be at least 8 per day. And
Yes,
of
ma'am.
course, we are not
Okay.
going to give any water to the newborn. Don't take it otherwise. So we are not going to give any water to the newborn. About the breast milk, and as it is for the complete thing, I'm saying.
Okay. 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 When is CT scan indicated in COVID for children? Dr. Anish, hi.
So when is CT scan indicated? I don't consider giving CT scan to the children. If required, we'll
So,
go for a USD chest and all those things. When a child is already having ARDS kind of symptom, which is like almost the lung is completely, and the child is having not maintaining the saturation, all those things we take. But even at that time, we don't go for a CT scan more often in a kids. We don't
oh,
do CT scan as a routine in the case of kids.
okay, okay. So there is one more question, ma'am. Does symptomatic COVID kids also have chances to develop MISC?
If it is a symptomatic or asymptomatic, whoever it is,
Okay,
that no one is spared from COVID, actually speaking. So even we adults are not spared from COVID. So I have the probability of getting, and you have the probability of getting. So even the COVID kids also, when we probe back for the MISC child, when we get back to them, most of them are not even aware that they are COVID positive because they did not have any test actually. So they went on asymptomatic. So even the symptomatic kids may also have this. So there's no
okay,
differentiation like whether it's a asymptomatic only asymptomatic is getting no symptomatic is not getting. There's nothing like that. So anybody
okay.
can get it.
Okay, ma'am. What is the difference between HFMD and chickenpox?
Okay, this hand, foot, mouth disease and chickenpox, both of them are viral disease. Okay,
Okay,
so another thing, these are going to have a presentation as a rash and then mucosal erosion. So HFMD is mostly aphthous ulcer and then rashes in the hand and foot. Okay, so mostly HFMD is not going to go on to complication. Only
okay,
2% of the child may get onto a complication. Otherwise,
okay,
it's like cool course only. Whereas chickenpox,
okay,
most of the child will have some complication, be it a pneumonia, diarrhea, be it like otitis media, whatever it can be. The child may end up in having some complication. For
okay.
HFMD, many of them will have like again both of them are communicable disease. So
Yes,
preventing, isolating, and early identification of the child from a contact person is all required. So
yes.
the another thing for the chickenpox, we have the vaccines. So taking the vaccine is almost protecting. Like 85 to
Okay,
95% it is protecting from getting a chickenpox. So if you have any vaccination, it can be present anyway.
okay, okay, ma'am. Yeah, and how many minutes of minimum physical exercise, especially physical activity, a child should do, ma'am? Because it's maximum. Schools are starting. It's like 2 hours, 3 hours of sitting in front of a screen for the child, and then sleeping, eating, and doing homework. Physical activity is becoming less. So,
Okay. So for anyone, be it a child or adult, I would say that every hour you just go for a 5 minutes or 10 minutes break and stretch yourself. That will help your back and everything. Even for the kids. So physical activity for the kids is like what we can say is that it again depends on the tolerance of the child, how much the child can do is all required.
okay,
So if you take a 3-year-old child, that will be running here and there throughout the day, and whereas a 10-year-old child will not be running, I will be sitting in the couch and watching TV or going for an online class. So it's better, like again, it's combined effect. Like when we as a parent just start doing something as a routine thing. Like for example, if we push the child to do some yoga or we push the child to do some kind of exercise, they will not do. So when we start
okay.
doing, they will have some kind of fun in that and they will start following us. So
Yes, ma'am.
considering that for anything like 8 to 10 years or above that age, I would say that half an hour is definitely required. Below that, how much ever the child is tolerating. And considering
Okay.
other conditions also. This is only for the normal healthy child, not for somebody who is
Yes.
having other diseases or something like that. So for the
Okay.
diseases, and it's always what the pediatrician says. That is all required.
Okay. Ma'am, I had a 4-month-old baby patient with dog bite. About what age can we give anti-rabies vaccine?
It's actually even from the newborn we can give. So mostly we don't think that newborn is getting caught with a dog bite. So after a month also we can give. So there's no contraindication for the anti-rabies vaccine.
Okay. Okay, ma'am. Yeah, I guess we've covered maximum topics possible, ma'am. Thank you so much for joining, and thank you, Ask Your Doctor team, and especially Dr. Anish for introducing ma'am.
So we Ask Your Doctor team is actually helping out in this pandemic, so anybody can use this opportunity.
And we can, if someone wants to consult you, ma'am, we can book the appointment through Ask Your Doctor
Yeah, you can,
website.
you can book through askyourdoctor.com. So any queries, anything, like we have a team of doctors. We have got so many doctors like surgeon, Dr. Anish is there, and you know well him. And we have OG also, we have derm also. So all the doctors are available, ENT, physician, everyone is available. So anybody, like it's like a complete complex thing that we can make use of it. So we are just actually to help out in this pandemic so that at least there is something that can be help to this society can be done. That is what is our motto actually. So you can
Okay.
consult anyway through Ask Your Doctor.
Okay.
Okay. So
Okay,
if
ma'am.
it's
Okay.
something like
Thank
requiring a video consultation or something, we will do it, not an issue.
you. Okay.
Okay.
Okay, ma'am. Thank you
Okay.
so much for your valuable time, ma'am.